Why did Meghan Markle have a miscarriage? In November of 2020, Meghan Markle wrote an opinion piece for the New York Times titled, "The Losses We Share." In the article, she described her experience of having a miscarriage. While she bravely opened up about this emotional experience to the public may not be too familiar with the etiology or epidemiology of miscarriages. The goal of this video is to build a basic foundation of knowledge about miscarriages to support the public's understanding of the personal story Meghan shared and the miscarriage experiences of many other people. Spontaneous abortion or miscarriage is defined as the loss of pregnancy less than 20 weeks gestation. The American College of Obstetricians and Gynecologists estimates it is the most common form of pregnancy loss. It is estimated that as many as 26% of all pregnancies end in miscarriage, and up to 10% of clinically recognized pregnancies do. Moreover, 80% of early pregnancy loss occurs in the first trimester. The risk of miscarriage decreases after 12 weeks gestation. Although the cause of most miscarriages is unknown, they presumably result from a complex interplay between parental age, genetic, hormonal, immunological, and environmental factors. Genetic factors, including parental chromosomal rearrangements and abnormal embryonic genotypes and karyotypes, could underlie more than half of recurrent miscarriages. The most common cause of spontaneous pregnancy loss in the first trimester is chromosomal abnormalities. In most cases, it is too early to determine the exact cause of the abnormality. Risk of early pregnancy loss decreases with increasing gestational age and is relatively low after 15 weeks gestation in a genetically normal fetus. Risk of miscarriage is multivariate, and while some maternal risk factors tend to be more important than others, there is no one predictor of future pregnancy loss. Maternal age is the strongest known risk factor. The risk of miscarriage is slightly elevated in the youngest mothers and then rises sharply in older mothers. In women ages 20 to 30, risk of miscarriage less than 20 weeks gestation is 8.9%. This increases to 74.7% for women over 40 years of age. Another important predictor in the risk of early pregnancy loss is prior obstetrical history. The risk of miscarriage in a future pregnancy is approximately 20% after one miscarriage, 28% after 2 consecutive miscarriages, and 43% after 3 or more consecutive miscarriages. Maternal comorbidities such as thrombophilia, antiphospholipid antibody syndrome, extremes of maternal weight, and hypertension all also increase the risk of miscarriage. Additional maternal risk factors have been identified such as cigarette smoking, large amounts of caffeine use, trauma, and malnutrition. Even without in-depth knowledge of the health and genetic background of Meghan and Prince Harry, the risk factors for miscarriages are complex. Nevertheless, Meghan's older age may be a leading factor. She turned 39 years old in 2020, and the risk of miscarriage for women over 40 is almost 75%.